lights, so we can see the screen better. That's better.
So, just out of curiosity, has anybody heard of low back pain before? Low back pain. Anybody heard of that before?
I think I have.
Yeah. Well, it's a rare condition. Very few people ever get it. It's actually the number one reason people go to a doctor.
I bet it is.
And so, I sometimes have this conversation with God and say, you designed the world so beautifully. Why'd you design the spine so badly? And I still haven't gotten an answer. But what I wanted to talk about today is kind of what are the reasons that people have low back pain? Why does that develop? And what can be done about it? Because even if we go back 5 years ago, what could have been done 5 years ago is dramatically different than what can be done today. And so it's important for us to get out there and help educate the community about what are the options that even your doctor may not be aware of. But to start things, I think it's important to understand how the back is held together. It's how it's held in place so that we can understand why it falls apart. And if you look at the spine, it's composed of a whole bunch of different little bones. And the value of that is that it gives us the ability to not just stand up straight, but to also move in so many different directions. And the body does that by coordinating movement along all of these bones. But what's required to create both stability and mobility? You have to have some hard structures, something to anchor to, but you also have some soft structures, things that create movement and mobility. But we know that as we age, things that are in motion are going to start to show signs of wear. And all it takes is one domino to start falling for the rest of the dominoes to then fall afterwards. And oftentimes the first thing that happens is that we start to lose the strength and the stamina of the back muscles. Because if you look at the spine, it's not just bones and ligaments, there's also a whole series of muscles that create that structural integrity of the spine. And it's the coordination of the movement of those muscles anchoring off of the bone and the bone anchoring off of ligaments. That all has to work together in order to create mobility, but also stability. So if we were to take the muscles that line this area here and look at it kind of like we would a suspension bridge, if you look really closely, you can see that there are pillars that create kind of like what you would look at as a bridge, where there are pillars going into the water. And then there's ligaments, like this right here, that create some structural integrity to those pillars that go into the water. But what really holds things up are these muscles that line this column right here in your spine. And just to give you an orientation of what we're looking at, if this is my spine and I take it out of my body, which I'm not going to, it's kind of scary, and then look at these muscles here, you can kind of envision this as being like a suspension bridge, where you have pillars that go into the water, which is the bone, the disc, the hard structures, but it's the muscles that hold everything up. And the first thing that happens as we age is that the ligaments that support these joints, for instance, so if you look really carefully, there's a joint right here. You can see that, right? Between the green and the white, this area right here, that's a joint. There's a joint capsule to that. I'm going to bring that back. I guess it doesn't really show up well here, but trust me, there's a joint capsule that surrounds this joint. and it keeps things together. The muscle anchors off of that and uses that as a pivot point to hold things up. So what do you think would happen if you were to lose the structural integrity or lose the strength and stamina of those muscles?
You're gonna have a low back pain.
Right, because now the only thing holding things up is that joint capsule right there. And if that starts to fail and you start to get some movement shifting back and forth, what's going to happen next? It's going to start affecting the discs, and the discs are going to start to degenerate. So has anybody heard of the term degenerative disc disease? So I'll tell you a secret. Degenerative disc disease is nothing more than degenerative wrinkles disease or degenerative gray hair disease. We can't call aging a disease. It's something that happens to all of us. But it is something to take note of, because it's not the disc that's diseased, it's the whole structure that is. And the disc is only the thing that's most evident on an X-ray or an MRI, but we really need to take into consideration that it's not just the disc, it's that whole structure. It's the muscles, the ligaments, the joints, everything is affected when we see that disc start to age or degenerate. So
the process starts long before you see it in the disc.
you got it, absolutely. And that's one of the qualms that I have is when people say it's degenerative disc disease, it means that they're waiting until the radiology shows up to label it something, rather than following the symptoms that you're having, following the achiness that you're having, and tracing it down to what is the problem, what is the defect that's causing that achiness to begin with. So explaining this whole system helps both you and me understand what your back is trying to tell us when it's aching, because not all back pain is the same. We want to understand what the origin of that back pain is in order to fix it. Otherwise, if we treat everything with the same formula, then, a quarter of the time we might get lucky, but 75% of the time we're going to miss the diagnosis and treat people for things that they don't have, which is oftentimes the case. So to kind of go back and look at the whole structure, this whole system is held in place by four major structures: the bones, the muscles, the ligaments, and then the disc. All four of those pieces have to work in concert for things to work. But if any one of them starts to fail, it's going to affect everything else, and it just becomes a domino effect. And initially, what we see is just achiness in the back. Eventually, that evolves into arthritis of the back. Eventually, that evolves into disc degeneration. And all of that culminates in spinal stenosis. Because if we were to look straight inside of here, look right through here and into that center canal, what we would see is the spinal cord, the spinal canal. So if I were to take away some of this excess tissue, you can see right in the center here, that what's green, highlighted in green right now, that's the space in which the spinal cord runs. And it's very, very valuable real estate because it doesn't have a lot of room. So if anything takes up space in that area, it's a problem. Now, does anybody have arthritis? So when you started having arthritis, what happened to your joint? What did you see in your joint?
Swelling out.
It started to swell up, right? Well, what would happen if you had arthritis in this joint? It's going to swell up, right? And so what did we just say? That spinal canal is really valuable real estate. Can it afford any swelling? It really can't. Now, a little bit of swelling over a very slow period of time that develops, your body can create accommodations to it. But if it happens at the pace that typically it does when we reach our 50s, 60s, more likely in our 70s and 80s, then the problem is that tightness is going to start to encroach on the nerves that are running through that area. And so typically what's done in that case, when you're labeled as having spinal stenosis, is they'll come in, a surgeon will come in and cut through all of that muscle to get down to this bone. And they can't really see underneath the bone, so they have to remove the bone in order to see the ligament underneath the bone. And what did we just establish? That the foundation of your spine, the foundational strength of your spine is found through what structures? What is the suspension bridge of your spine?
Yeah, bone, muscle, and ligament.
It's bone, muscle, and ligament. So if they have to cut away the muscle, and they have to cut away the bone in order to open up that space, they're treating one problem, but it's also introducing other problems. And that's why we see such a high rate of reoperation a few years out from an initial surgery. So a lot of times spine surgery will lead to further spine surgery because they're fixing one thing, but they're introducing problems that can lead to other issues. So wouldn't it be nice if we could go in there and shave out that ligament without really damaging the muscle, damaging the bone?
Are you doing that through gamma knife or?
Great question. So one of the more recent innovations has been the ability to go into that ligament with a straw and under X-ray, so we're not actually having to remove anything to see what we need to see. Under X-ray, shaving that out. Do you have some of those model brochures?
I do. I was waiting for
This will help explain this a little bit better. If everybody, once you get this brochure, if you turn to this first page right here.
So is it like heart catheterization, only now you're doing it?
That's a great example. I hadn't thought of that.
Okay.
Yeah, it's kind of like a catheterization, except instead of using arteries to find the way into the heart, we're using X-rays to find our way into that spinal canal. So, if everybody looks at the picture on the left-hand side, turn the page to that first page. And if you look at the picture on the left-hand side, that would be what you looked like when you were in your 20s. You had this nice canal open. It had this round space where the nerves and the blood vessels that go to the spine can run. But as we age, and does everybody understand what we're looking at? This view is if I were to cut myself in half, and I'm not going to do that. If I were to cut myself in half and look straight down the center into this canal, this is the picture that I would see. So if you look at this, this triangle on the bottom part is this bone that we're looking upside down. So it's kind of like we're looking at things like this, where I'm looking down into the center here. So this bone on the bottom is this bone right here. And then this space on the front side is the disc, and I'm looking inside of this canal. So when you're 20 and you don't have any back pain, it's because this canal is open, there's no arthritis, there's no looseness to the ligaments or the disc in your spine, and so it's nice and open. But as we age and we start to get that motion, that excessive motion going on, which will degenerate the disc, which will cause arthritis in the joints, and will create thickening of everything. Both the disc will bulge backwards and the joints will grow out. That will start to encroach on that space, and what ends up happening is we get something that looks like the picture on the right side, where that redness is a ligament that starts to thicken. And initially that thickened ligament is actually what's creating stability until the rest of the body can catch up. But if that goes on for a long period of time, what ends up happening, everything else catches up, things stabilize, but you end up having that stenosis remain, and that will start to cause symptoms that oftentimes people describe as like an achiness in the back of your thighs. Oh, it's okay. I can work through it. There's an achiness in the back of your thighs. You ever find yourself going to the grocery store and you're leaning over on a cart? Has that ever happened to you? You know why that happens? Why you do that? Why it's not even something you think about. It just happens. And the reason is because what you're doing is you're actually creating more space in that spinal canal. Because by arching over, you're pushing everything away from the spine and creating a little bit more breathing room in there. So ideally, we would come in without disrupting anything else, and we would just shave away some of that ligament, open that space up a little bit, and create the same amount of room or more room than when you lean over. And if we can do that, then it improves the circulation in that area, and functionality can improve dramatically. But what I always tell my patients is that bear in mind, there's no magic bullet that's going to miraculously take away 20 years. So we're taking this bit by bit and understanding what else is going on so that we can start looking at the whole spine as a whole. And this is our first step, is to create a little bit more breathing room, but we then need to start treating the things that led to that ligament starting to thicken to begin with. And that comes through creating greater strength in the muscles of the low back. So all of these muscles we need to work on, because if we're ever going to restore that suspension bridge, the first thing we need to do is regain some of the strength within the muscles that line along here. And they're not muscles we think about, because it's so easy to slouch and put all the weight on the joints and the disc. And every time I say that, people sit up a little bit straighter. But it's so easy to slouch and just let everything collapse on the bone and the disc that we don't think about those muscles. And so over time, what ends up happening is we start to lose those muscles, and they get weaker. And so once we create a little bit more space and we give you the opportunity to move and be more active, then we need to start strengthening those muscles. And sometimes we even need to come back in and strengthen the ligaments that are lining these bones. And we can do that with some of the newer techniques as well.
So can you do this procedure on someone who's had a microdiscectomy or a discectomy itself?
It's a great question. So yes, so people who've had surgery in the past can still develop stenosis. And if they do have stenosis, then yes, this is a very fruitful procedure to do. Even in areas where oftentimes they may take care of stenosis in one level, but you've got 5 levels that are at risk for that stenosis. And so what often happens is the body will shift the stress that's been felt there and move it up or move it down. That's why we see those reoperation rates. We see those recurrent surgeries, because once they've done one, it's going to just take the load from one area and put it on everywhere else. So yes, we can come in and do that. But there are also other reasons people still hurt after surgery. A lot of that is because of the changes that take place when they have to cut the muscles, and the muscles scar down, they don't form right, or they have to cut away the bone, which takes away the anchoring for the muscles that need to be there. Make sense? So the same processes take place in other joints. It's just that low back pain is such a common problem. 80 to 90% of people will have low back pain at some point in their lives. But the rest of us will also get knee pain and shoulder pain. And a lot of these concepts are similar. The main intent is to really first figure out what is the root cause of the pain, not make any assumptions, because x-rays and MRIs will give us just one indication of a problem, but it's not the full picture. So it's really understanding what's the full picture of what's going on. And I use an acronym we call HEAL, which is, H is for hearing the message that your body signals with pain, meaning think of pain as not a condition, but rather the symptom of a condition. And what we need to do is trace that symptom to the problem. It's not, if you have high blood pressure and you have gray hair, it doesn't mean your gray hair is causing your high blood pressure. And it's the same thing. just because we're seeing degenerative discs doesn't mean the degenerative disc is causing the pain. We want to understand what's the root cause. And then we want to, going back to that acronym HEAL, we hear the message that your body's trying to convey the pain. And then we want to envision what you want to do about it, or envision your goals, because some things are not necessary to fix. There are certain structures in your body that allow you to play, heavy athletics, or be the fastest baseball pitcher or the fastest runner. But when we get to our 70s and 80s, it's not necessary to be the fastest runner or have the fastest pitch. We just want to be functional. So it's understanding what are your goals so that we can really get to the bottom of how we can help you best without doing too much or risking more complications. Then we want to figure out how to alleviate the symptoms. That's the third step in the HEAL process. Alleviating the symptoms doesn't mean eliminating pain. It just means we want to try to control the pain as best as we can until we can get to the final step, which is leveraging healing, or leveraging what your body normally does to fix things, and do so in a more intelligent way, so that we're not working against the body, we're actually helping the body heal, instead of trying to take the place of what the body does by, say for instance, doing surgery, or taking out structures, or replacing it with hardware.
Do you treat cervical stenosis the same as you do lumbar stenosis?
So it hasn't been done in cervical stenosis, but I think that is in the works. Cervical stenosis tends to be a little bit easier to address from a surgical standpoint, but yes, there are some techniques that people are working on to address it without surgery. And there are some injections that work really well for cervical stenosis. You have a little bit more room to work with in the neck than you do in the low back.
Is that your feet?
What other questions do you have? I know we covered a lot of ground. Wow, you guys are a healthy bunch. No problems at all here.
Yeah, we
Do you have
sure
any
are.
questions? Oh, okay.
Does anybody
So-
know? Go
I'm
ahead.
sorry.
Does anybody know anybody who's had spinal stenosis or has had surgery in their back?
I have. I actually herniated L5S1, so I had a microdiscectomy in 91, I think it was.
Yeah, so, and that's a little bit nuanced. It's a little different because you can think of the disc as being on the front side and the joints being on the back side. And so this was a herniation that came through the front side, which is treated a little differently than the ligament thickening on the back side. Nowadays, what we can do is we can actually go into the disc and inflate the disc itself, as well as heal where the tear was, without needing to take out that piece of the disc.
Yeah, I've not heard the term spinal stenosis used, but we've heard the slip disc,
Right.
et cetera, blah, blah, blah. And I've known one of my sons and a friend who had spinal surgery. I do not know the extent of that, but less than satisfactory results. That's why I'm interested in your presentation.
Yeah, that's often what I see. It's
And apparently that's very common.
It is very common. So the 30% of people improve at 2 years out. 70% of people continue to have symptoms at the same level or worse. So surgery hasn't been terribly successful. In certain situations, it's unavoidable. It has to be done. But I would say vast majority, 80-90% of spine surgeries, we now have ways to get around it and prevent the need for having surgery. Yeah. Because the other advantage is that a lot of people who deal with spinal stenosis are older individuals, and it's really hard to take them into the operative environment because they have to get anesthesia, they have to put a breathing tube down, and those are all very high-risk things as we age. The advantage of this is we can do it even without putting people to sleep. I can just do it under local anesthetic, And we have to do it in an operating room because it has to be in a sterile environment. But people are talkative, they're giving me feedback, they're saying, oh yeah, that hurts, that's where my symptoms, that's what I feel when my back hurts. And so we're able to even refine things even better just by the fact that that person is awake and we're able to talk to them and get a sense of what's going on.
That being,
Outpatient, they're home that evening?
Yeah, patients come in the morning, we do the procedure, and by, within 2 hours, they're back home. Oftentimes they feel an improvement pretty quickly, but they're sore from just having had that procedure. But within 2-3 weeks, almost everybody who's had this procedure is walking upright, they're doing a whole lot better. It's not the end-all fix, but it's a huge step forward, and then the rest of it comes with time and other treatments.
do you do rehab, or do you have a rehab connection to your practice?
It's a really good question, because one of the other qualms that I have, or concerns that I have, is that there's not enough rehab done after surgery. A lot of times, the surgical mentality is we do something, we fix it, and you're gone. But a really good surgeon will then say, look, we fixed some things, but we've also created some problems that needs rehabilitation. Because if you're cutting through muscles and you're not giving the muscles the direction of how to reorient their muscle fibers, how do we expect that muscle to ever form correctly in the right alignment? It's going to form in this gall. And that's oftentimes what's painful and uncomfortable after surgery. But even after this procedure, I still recommend physical therapy. And we have a number of colleagues all over town that we work with and have close communication with, because that feedback between the physician and the physical therapist helps both sides a lot. A lot of times I'm able to tell the physical therapist, look, while I was working, and because I'm able to view things in real time. Like as I'm doing the procedure, I'm looking through you on the inside, whether it's through ultrasound or through x-rays, but I'm actually able to see the structures inside as I'm working. And as I'm working, I'm able to tease apart some issues and tell the physical therapist, look, while I was working on the inside, and I had the hood up and I was had my head deep inside the engine and looking inside, I was able to see that this is another problem that may not be evident or may not be obvious while you're just looking at the outside or exercising. And then on the flip side, the physical therapist can tell me, hey, while I was working, I noticed that this muscle is way weaker than the rest. Can there be a nerve problem there, or can there be a muscle problem or a ligament problem that's contributing to that and making this worse or making that muscle weak over time?
We see a lot of discussion, and you mentioned the supermarket cart within these rascals.
Yeah.
We hear a lot of discussion of, so my question to you is, are we causing or aiding or abetting the standing upright in the walkers and not leaning on them and going forward? Is the leaning forward something that the walker tends to cause you to want to do, or are we leaning forward because there's some spinal issues?
Right.
In other words, which is the cart and the horse here?
Right, chicken and the egg.
Yes.
And it's a really good question, because there's a fine line between both sides. And it's a line that we have to carve out, because mobility, movement, is really the fountain of youth. The thing that keeps us young, that keeps us regenerating, is movement and exercise. So I would rather somebody be mobile with a walker leaning forward than immobile and sitting down. However, if you become dependent on the walker and never challenge yourself to stand up, then the muscles are just going to keep getting weaker. Where it's helpful to have a good clinician on your team is where they can start to tease that apart and differentiate. Is there a mechanical dysfunction or a mechanical limitation? Like if there is stenosis there, it's mechanically limiting for you to stand up. You really cannot do that, because the moment you do, it pinches everything off and you just collapse. So if we can get a better understanding, like follow the symptom of pain and figure out what's causing it and understand, is this a mechanical limitation or is it a strength limitation? Because if it's a strength limitation, then yes, I would wean you off of the walker and start giving you some exercises to strengthen your spine so that you can stand up straight. But if it's a mechanical limitation, like there's stenosis in there, then it's kind of pointless to try to get your back muscles stronger until we actually address the stenosis, until we open that up and mechanically make it possible for your back to get stronger.
Yeah, in my case, I used to say I've got arthritis in the knees,
Right.
and at my age, I don't want to fall.
Yeah.
So this is a safety
And I completely agree with that.
mechanism for me. And
Because
I don't have to use it all the time, but I'd rather run around with this than go down.
I completely agree with you, and I would say the same thing, and that's a really good point too, because one of the other problems I have in medicine is that we've all become so siloed. Everybody specializes in knees. Somebody specializes in knees. Somebody else specializes in shoulders. Somebody else specializes in the left eyelid. Somebody specializes in the right eyelid. It's become so separated that we often forget that if you have back pain, it may be because you've been dealing with knee pain for such a long time that you've changed the way you walk to accommodate your knees, and that's what's actually causing your back pain. So talking to somebody who has expertise in the whole spectrum is important, because if I'm to get your back better, I may also have to take care of your knees. And there's a lot of solutions for knee arthritis. We always think of arthritis as an erosive problem, like it's the cartilage that's just wearing away. But our bodies are not like our cars. You don't wear away a cartilage. Your cartilage is always regrowing. It's just that the pace of regrowth is not keeping up with the pace of breaking down. And so we have two options. We can either figure out why you're breaking down at a faster rate, or we can try to increase the pace at which you repair yourself. And oftentimes it's a little bit of both, because similar to the spine, where the first problem is instability, where things are just moving the way they weren't designed, same thing is happening in your knee, where if it's moving the way it was designed, it's not going to rub away, it's not going to erode. But what happens is we lose integrity in our joints, and the joints start to slide back and forth. And that's what causes excessive erosion or excessive breakage that your body can't keep up with. So a lot of times we can just simply strengthen the stability of the knee, whether it's through physical therapy or through other techniques that create stronger bonds in the ligaments and allow your body to actually heal itself. And if it doesn't, then we can come back and repopulate the cartilage in your knee.
Thank you.
I think you had a question.
One time I fell and I sat down real hard. While I was sitting there, it seemed like something went up my back, all the way up my back, notch at a time, just like that.
Yeah.
Seemed like it was a minute or two going on. Maybe it wasn't that long, but it sure felt like it. Notch for notch, all the way up my back. Now what was that?
I'll show you.
He's gonna show you.
Well, that's what he's talking about.
That is quite
What he's going to
something.
show you.
That's quite
So-
something.
You know what he's going to show you on that screen, and we can't see that
Oh,
screen.
I'll tilt it.
That's
See
right.
that? That's
Now
much
then.
better. Now he can see
You should
it.
have said that earlier. I was doing all this work up here.
Well,
Alright. Look at these muscles right here and here.
can you hear him, Charles?
Yeah.
Okay.
So, in your spine, all of these muscles, even though they're individual muscles, they coordinate with each other. So, if you have a big fall and it jars a ligament or it jars the bone, or some kind of trauma takes place in your spine, it causes a domino reaction because the rest of your body is trying to brace itself and protect you from further injury. Sometimes it's a good thing, sometimes it's not a good thing, because a lot of times, I'm sure all of you have heard of somebody bending over to pick up a piece of paper, and all of a sudden their back catches and they can't move anymore. Well, what's happening in that situation? It's the same thing as what happened when you had that fall. It's not because all of a sudden randomly your body decided to torture you. It's because your body is trying to protect you from something. So the issue is oftentimes that it identifies some kind of a looseness or laxity taking place. Like you
They
move,
did it one notch at a time, it's all the way up.
right, well, each of these are,
So it'd be showing you
it's a
where we're
domino
at.
effect.
Yeah.
If this contracts, then it's kind of like your knee jerk reflex, where you bump your knee and your knee kind of moves on its own. Well, if this contracts all of a sudden, and then this muscle suddenly stretches out because it's reacting to this muscle contracting, this one then thinks something is wrong, and so it contracts. And then it does the same thing up here, and then this contracts, and it just
So
keeps
that's what
kind of
happened to you, John.
follows all the way
So
up.
that's what happened to you, yeah.
Does that make sense?
It's a funny feeling.
I didn't feel that it was, my dear.
But if nobody told you that your knee has a reflex, if you never went to the doctor and had somebody bump your knee and it reflexes like that, that's a funny feeling too.
Sure it is.
So a lot of those reactions where your body all of a sudden goes into spasm, they're indications of something being wrong or something being too loose. And while the initial problem might go away and get better, and you might never think about it again, it's actually something worth looking into because it's likely to recur unless we do something to get that structure stable again. If we don't get that joint stable again, then it's likely something to recur.
What's the connection between spinal stenosis and what you're talking about now with that, I think of as a back spasm?
Right. So,
And do you have the same sort of what is your,
so spinal stenosis is
a
like
specific,
it's the downstream effect of what caused the spasm to begin with. What causes the spasm to begin with is that your body recognizes looseness somewhere. Like if all of a sudden this bone is moving forward and backwards, and it happens, suddenly, well, it's going to cause these muscles and a group of other muscles to tighten down,
to spasm?
to prevent that movement from continuing. And if that spasms really quickly, it can actually break some of those muscle fibers, and then it becomes kind of this chain reaction where the breakage within those fibers causes more muscles to spasm, and then more break, and then more spasm, and more break. So it just keeps going like that. And that's why we see oftentimes those kind of bending over, picking things up situations will have like 3 or 4 days of really intense pain, and then 2 or 3 weeks of lingering pain. And then it goes away and you never think about it again until it happens again.
Until it happens again.
And what's happening is that the initial movement is causing those muscles to spasm, and then those initial breakages of fibers causes a reaction or an inflammation that will last 3 or 4 days, and then it takes about 2 or 3 weeks for your body to put everything back together and fix it all up. So if that looseness goes on for a long period of time and the muscles can't keep up with it, what starts to happen is other structures try to take up for it. And so the ligament starts to thicken, the disc might start to lose its integrity and bulge backwards. And so the downstream product of that, all of that, is stenosis. But if we look way upstream, if we could catch that looseness before it evolved into the stenosis, there's a lot of things that we could have done to prevent the stenosis from forming to begin with. But so I look at things on two sides of the fence. One is the problem we currently have, and then what started the problem to begin with, and how do we both fix the problem we currently have, but also prevent it from happening again.
If that looseness is caused by aging,
So,
what is your recommendation for those of us that don't have it yet?
The fountain of youth. What did I say was the fountain of youth?
Motion?
Motion.
Motion.
Yeah.
That's what I keep hearing over and over again.
Because
motion is lotion.
motion is lotion. Because why do we get that looseness to begin with?
Yes, that was.
So one is nutrition is a big deal. Knowing what to eat, and even timing we're finding is a big deal. Like what to eat, when to eat it is important. The second is that as we age, the hormonal changes that take place in our body cause ligaments and tendons to lose their elasticity. So the water content of these structures starts to go away. We start to dehydrate. Loose skin. Why do we get wrinkles? It's because the water content underneath the skin is starting to the structures are losing their ability to hold on to water. And so we start to get a thinning out of the foundation underneath the skin, and that causes the skin to kind of overlap and form wrinkles. So if we were to fill out the face, like if you went from skinny to fat, you'll see that the wrinkles go away, and it's because you're artificially inflating that space. The same thing is happening to our tendons, our ligaments, all of our connective tissue. And as those structures lose their water content, they lose their elasticity. So if I go jumping up and down, the reason I can do that is because the tendons in my ankles are creating elasticity. And as I'm jumping, it doesn't take a whole lot of force for that ligament to stretch and contract and create that rubbery bounciness. But it's hard to do that as you age. And it's not because your muscle is weak as much as it is that the tendons have lost their elasticity, their rubberiness. Let me ask you this. How many people find that when you wake up in the morning, you get up out of bed, everything hurts more?
Everybody in the room?
Anybody else have one? So why is that the case? It's because as you're sleeping, you're breathing, and you ever breathe on a cold window and you make a little smiley face? It's because you're breathing out the moisture of your body. And so everything in your body is trying to compensate for that loss of moisture. And where you feel it the most is in those tendons and ligaments where they start to contract because they're losing moisture. And when you get up in the morning and you start walking around, everybody gets up and they're like, oh, I hate mornings. And it's because you're trying to rehydrate all of those ligaments and tendons. All that fluid is recirculating and prioritizing to go into your tendons and ligaments. That's why I always say keep a glass of water by your bed. First thing you do when you wake up, after you pee, of course, is you drink that water.
No, shut this down pat, doesn't it?
And then you hit the snooze button a couple more times. So you take a few more naps and you let your body rehydrate. You might even do a couple stretches before you get up out of bed. And that'll help lubricate things to move again. And as we age, it becomes really important to maintain that motion, the stretching, the full range of motion, because you want to constantly be stressing your tendons and wake them up and say, hey, you need to keep forming new tissue. Otherwise, you're going to become more and more vulnerable to breaking, and that's going to cause problems down the road.
Does actual physical humidity in the room then help?
That's a really good question. I don't know the answer to that, because I will say that there's a reason people seem to migrate to Florida when they retire.
That's
Because
true.
I cough at night if I don't keep the humidity up, and I have strange ways of keeping it up, so I won't go into that. But
Well, and that's a completely separate topic. But yes, I mean your throat dries out and your vocal cords become very sensitive to movement because they're so dry and they're so brittle when they're dry. So yes, humidity at night I think is a great idea.
What about using the CPAP machine?
Same thing. It should have a humidifier on
It
it.
does.
Yeah, because otherwise it just dries your throat out.
If you get a CPAP with heated tubing, it's quite nice.
Yeah, that's nice too.
The heated tubing?
Ooh.
there's something new.
Have to check. That sounds good.
Any other questions?
Thank you, this has been very informative, and the questions we've thrown at you that we had.
Well,
Appreciate it.
our practice is a little unique. We have a lot of different philosophies than mainstream healthcare, and part of that is that we try to educate the community, because the more you know about what's taking place in your body, the easier my job becomes. So we try to take a little bit more time with patients when they come in to really understand what's going on. But a big part of it is also us being on the same page, you understanding what's going on in your body to help me help you better.
Are you trained as an MD or a DO?
My background is an MD,
Okay.
but I always joke with my DO colleagues that I have DONV. Because I really appreciate how holistic their education is, as opposed to what I saw was a very siloed model, which is now we're going to talk about the heart and nothing but the heart. Now we're going to talk about the brain and nothing but the brain.
Do you have this is great until the process, but business card?
We do, yeah.
You
We've
have
got,
information on your,
I'm gonna leave some
You've got
information
handouts
for
on
you all,
that.
yes
Okay.
ma'am.
Good,
That's good.
all right.
and if we can help, whether it's just a question, so we do a lot of information on our Facebook page, we do every other week we do a show, and you're able to call in or type in your questions, and we'll talk about a topic, and then if you have questions, by all means ask them. We'd like to have more participation on that. So we'll do things like this on the show, so that we can, again, educate the community and
Great.
help improve how we age.
Do you have a nutritionist on?
One of
Routine.
my physician assistants is really heavy into nutrition, and so she does a lot of nutritional counseling. But we're kind of in the early stage of our development, and what we want to do is to bring all of the appropriate disciplines, nutrition and psychology and physical therapy and exercise, all of it under one roof, so that we can really look at you as a whole being as opposed to little bits and pieces.
So are you a functional group at the moment?
We are, yes. Do you remember the Eagle Creek Library where across from St. Joe East? So that's our new office.
That's nice.
Yes.
Good for you.
So the intention was a library is a community resource. That's what we want to be. That is the foundation of our practice, is that we want to be a community resource and help people live their lives in a healthier manner. Because I don't like how healthcare it essentially disempowers people and says that you can't heal. You're dependent upon us to heal. And that's not true. We as healthcare practitioners should not be the entity that cures disease. We should be the entity that guards health and helps you live a healthier life, helps your body heal, as opposed to trying to take the reins away from the body and replace it with metal and plastic.
May I ask where you were trained?
So I actually am a Kentucky boy. I grew up here. But then I went off to Johns Hopkins for my medical school training, and then stayed there and did a training in anesthesiology. And then I went to MD Anderson, which is a big cancer institute, and that's where I learned, did my fellowship in pain management. And then subsequent to that, I've done a lot of training in musculoskeletal medicine and non-surgical orthopedics. And I'm now actually one of the instructors for the American Academy of Orthopedic Medicine.
That's great.
Thank you.
You're welcome. Thank you for attending.
Thank you so much.
And if this is helpful, we'll come back and do it again. And tell your friends, invite your cousins.
That's a nice offer. Okay, got the information, I guess?
Yes, ma'am. I've got all kinds of good stuff for you guys.